Hi, my name is Eric Thompson. I'm a physical therapist with First Choice Home Health, and we go around the facilities, and one of the things I do is teach staff to safely transfer their residents. So today what I want to talk about with you is what not to do so we can keep ourselves safe and the patient safe, and then also how to appropriately transfer one of the residents from sit to stand or a pivot transfer. So some of the main offenses that I see people do, which can get themselves in trouble or hurt the residents, is they will grab under someone's armpit here like this and help lift them up. Or they'll grab from the back and help lift them up. And so even though they look like nice little handles for us to be able to help pick them up, what happens, and I've had 2 shoulder fractures in my career by this. And if we look, if I'm picking Sadie's arm up, you see that movement in that lax joint. What that can do, that can break her shoulder, it can dislocate her shoulder, or all of her nerves come out of her neck under her armpit and they innervate her hand. You could paralyze her arm. So at no point should we ever reach under someone's armpit and help them stand up, okay? And sometimes I'll see caregivers tell the patient to grab my neck, right behind my neck. Go ahead and grab behind my neck. Okay, I'm gonna help lift you up like this. And a lot of times the patient will pull on someone's neck, and I've seen caregivers have neck injuries from that. So never okay to have the patient grabbing you either. Instead, what I like to have people do, if they have a walker in front of them, let's say we're in a wheelchair here, and we've got a walker in front of us, patients will instinctively try to reach for that walker to help pull themselves up. And that usually does nothing for them. So I always correct them, let's not grab the walker to pull ourselves up, but let's use the armrests on the chair and help push ourselves up. Once they're standing, then they can reach and grab for the walker, okay? So some of the things when I'm going to help somebody stand up, and this makes it so much easier for me, I do a whole lot less and they do more of the work. When I see a patient, sometimes they'll have their feet out a little farther and they'll try to stand up like this. What has to happen here, for somebody to stand up, their center of gravity needs to come over their feet. So if I have Sadie stand up, Sadie, go ahead and use your hands on the armrest and stand up. Keep your feet out there though.
That's hard to stand.
Go ahead and keep standing up. Right. So yeah, she even had to reposition her feet.
I did.
Go ahead and sit down. And what's difficult for these residents is they have to go from here to here. And that's so much extra effort versus I have somebody pull their feet back and I want their feet under their knees or a little farther back, okay? Sadie, go ahead and use your hands and stand right up. Much, much better. And you will find just having them pull their feet back makes a world of difference in how much assistance you need to give them to help them stand up. Okay, Sadie, go ahead and sit down. Another thing that I encourage people to do, Sadie, you're gonna fake this, and you'll see this in the residents. When they try to stand up, they don't lean far enough forward. So they'll stand up and they'll fall back into the chair, and they'll do this several times. Okay, Sadie, go ahead and demonstrate that. And they will do it. They'll come up and they'll fall back. And what's happening there is they're not leaning far enough forward for them, their center of gravity to be over their feet. So go ahead and sit down, Sadie. So I'll see a patient, I'll come into an assisted living and they'll tell me that Sadie is a max assist transfer. So she needs 100% help to stand up. And so when we go over some of these techniques, we turn them into a min assist transfer, which is I'm doing 25% and Sadie's doing 75% of the work. And just changing some of these mechanics a little bit makes that much of a difference. So when I help someone, my goal and my purpose is never to lift them up to help them stand up. I just want to encourage them forward, because almost everybody, if you get their center of gravity forward over their legs, they got enough strength in their legs to stand up. And so how do I assist patients this way? Again, we aren't gonna reach under the arms and help them forward. What I do, and you guys are to use a gait belt, so we've got a gait belt on Sadie here. I stand to the side, and I can stand to either side, okay? And what I'm going to do, well, again, Sadie's in a wheelchair, so I've educated her to pull her feet back. Her hand, she's not gonna reach for the walker. What happens sometimes if we're gonna transfer a patient, and I like to count 1, 2, 3, let's stand up, they'll often grab right for the walker. At that point, the transfer's over, we re-educate, get your hands back here, okay? So we want them to do it right. Also with the counting, I like to count so that the patient can be involved. I don't ever want to lead the transfer. I'm here just assisting only if necessary. And what you'll experience sometimes too with patients is if Sadie has a little bit of confusion and she doesn't quite understand what we're doing, and I'm just coming in here, maybe I'm talking to her, but I'm not allowing it to sink in, and I try lifting her, a lot of times the resident will resist you because they're scared, they don't know what's going on. So I always have the resident initiate that stand-up, okay? And then I help them only as much as I need to. And my help is not a lift, it's always just a push forward, okay? So Sadie has her feet back, her hands are on the chair, and I'm telling her, okay, on 3, we're gonna lean forward and stand up. And so I have the gait belt, and you can use one hand or 2, okay? And on 3, well, let's stand up, Sadie. 1, 2, 3. And Sadie's pretty good, but it does work that easy. All I'm doing is pushing someone forward, okay? Now, when someone's standing here, what you may see sometimes too is that they, when we've gone to the bed or to the toilet or to the dining room chair, it's time for them to sit down again, they just plop down. Go ahead and plop down, Sadie. Right. So we don't want them to do that either. What can happen there is, I've had plenty of residents where they get a compression fracture in their spine from plopping down on a chair like that. So Sadie, let's stand up again. So instead, we have them back up until they feel the chair with their legs. Now I want them to reach back with one hand, grab the armrest, reach back with the other, and slowly control their sit.